right. Good morning, Delaware, and good evening or good early morning, India, and everyone else joining us from multiple time zones. Thank you for attending so early on a Friday morning. I know some of you are working. My name is Michael Mastroianni, and this is a soft skills presentation. So just be warned going into that. I am a project manager, mostly working on the information technology and information security side of new medical apps and processes, often related to, at this point, COVID infection prevention and tracing protocols at some of your neighborhood hospitals, especially if you are in Maryland, Delaware, or the District of Columbia. Also, briefly going into some interesting ballot security stuff that came up this year, of course, during the election, as well as where that led us as information security specialists. As you'll probably see from the slide here, this was originally developed more for the dev and IT crowd in corporate settings, but at the urging of the incomparable Janice Paulson, I started thinking more about InfoSec this year, and also wanted to bring this presentation to more of an InfoSec crowd. So this is its first time out. What does emergency communication mean, especially, and also what does decision maker mean here? Well, when I'm talking about emergency, there are two different kinds that you're probably going to run into as any kind of information technology professional. First is where chaos reigns, which is usually a big crisis or an organizational crisis when something has gone terribly wrong or is about to go terribly wrong. In some cases, you might be the InfoSec advocate that recognizes that and no one else does. And also, a smaller emergency usually is when there is no help, which is more of a team emergency or a project emergency, usually when someone coordinating your work with other vital members of the team isn't available. So when you're going into either kind of emergency before you start, the first thing you should be doing as an InfoSec advocate is know the other ones on your project team or in your organization. Unfortunately, in some cases, and this is also what I determined working with Compass early on, it might just be you. And this does give you a lot of opportunities, but it also opens up a lot of risks. And that is more what we are going into today. So let's start with the big emergencies that you often encounter. That is where chaos reigns. What do I define chaos as? Well, it's really hard to define, but in this particular case, let's take it as it is, especially from a hacker perspective. A project or an organization has or may be imminently compromised by an attack, a breach, a flaw that you've discovered, an internal element that could be human or signal, or an unscheduled test. Because if a project or organization breaks down during one, then there's probably something seriously wrong. We usually prescribe CPR for these cases. That's communication, preparation, and reaction. Communication is usually determining who you can communicate to resolve issues that you see coming or that are already happening. Preparation is doing what you can alone and with those people. It's important to cooperate when you can, but also be ready to do the work when you can't. And also reaction, which is running the plan you're coming up with and being prepared to deal with the unpredicted. Something that's been coming a lot up in the human resource and corporate world after spent a lot of time in psychology and sociology is the risk and resilience model, which originally was designed to determine personality resistance through trauma, but also has been used to track a lot of community and corporate factors. As it applies to a lot of the communications we're going to be talking about, it goes from detecting or identifying an anomaly, which in a more psychological model might be a stressor. An anomaly is anything that's going wrong at this particular juncture, and then sorting out the risk factors that it opens up a project or organization to. Usually in this term, you're seeing the bullseye on the left, or two from the left, to show risk factors are usually sorted from closest, or in a psychological environment, more intimate to more remote. So the ones that are more of an acute risk to a project or org are at the center. And then you have protected factors. So these are usually just the positives to the negative, but they're grouped in different ways because protective factors for a person, just like an organization or a project, always interrelate or interact somehow. And that's usually what makes protective factors smaller. Just to go off of what we were hearing in the keynote about the importance of preventative measures in the pandemic, we're talking about protective factors being masks, hand washing, limiting your distance to friends, the possibility of contact tracing in the case that you fail to prevent infection. These are all the protective factors that work together and strengthen each other because none of them are 100% effective on their own. It's usually the same case for corporate resilience, as well as InfoSec resilience when you're coming back from some sort of attack, breach, or flaw. And then, usually, if you are doing a postmortem, you're sorting outcomes by both positive and negative to try to strengthen your organization's response in the future. So, what does this mean for the InfoSec professional? There's a lot on these slides, but there's also a lot that we're covering in a short period of time here. So, from the macro perspective, it's often important for InfoSec professionals, especially if they feel like they're the only advocates in the field, to cultivate a culture of information security and good governance. These are both very important sort of twin aspects that work in organizations, and organizations usually pay when they fail to recognize one or both of them. So, InfoSec, in this particular case, cultivating a culture of security would be having more people become InfoSec advocates. You're doing a lot of recruiting here. There are usually more IT professionals related to what you're doing than might even be on your team. When it comes to using the resilience model, it's often your job to translate that for information security. So we're talking about reducing identifying risk factors that you can reduce and identifying protective factors that you can increase. You also often need to identify the ones that you can't do anything about, just to be aware of them in an environment, because we're usually doing our best work when we understand more about the context we're working in. So what does this look like when you bring it to the rubber meets the road for the organization? Well, a lot of the time it's one-on-one time with the people who can make those decisions, like the chief information officers, VPs of technology in particular organizations, and understanding how they have the rationale to make decisions. This usually involves case studies and numbers, especially when it comes to medical care executives, both in the nonprofit realm and for-profit technology development. And this is what we're going to spend a lot of our time working on, is how to use these to your advantage as an InfoSec advocate. Other ways of trying to make a difference at the macro level are creating an office of InfoSec czar or a task force. Task force often best involve teams from a lot of different disciplines like finance or elsewhere in the tech world in an organization like dev, and also detractors. This is an important place to bring people who are not particularly prioritizing InfoSec or might not particularly believe in your mission here, because they're the ones who diversify our thinking and also give us a lot of information on how to promote InfoSec in an environment. And also, if you come up with solutions like new third-party apps or work that IT can do, protocols that we wash a lot of prospective apps and programs through, which is something I do a lot of, it's important to get the staff buy-in, because everything is going to be easier, and it's also going to be easier to track your performance and see if what you're doing is actually working. On a micro level, there are a lot of things where a more technical view would probably be helpful here, but economizing code, so things that so forensic investigation would not take as long, so forensic investigation would not be necessary in the first place. This is something where more of a technical aspect would probably be answer those questions. When it comes to third-party applications or things where you might be called in to consult, we often try to figure out, how do these work with other parts of the system? Can we confirm that they're interoperable? Can we streamline that interoperability in any way to reduce any risk that data that travels through it might encounter? Scheduling user tests to make sure that users are able to navigate all of these issues, and also we're getting into user experience a little bit later, as well as stress tests, which might be something that only you are responsible for even conceiving, let alone planning. And it also comes down to more of an InfoSec presence in decision-making meetings beyond the conversations that you have specifically about information security with the professionals around you. And as we mentioned, case studies and numbers. This is just the number one way of getting your message to people who are not information security professionals or technical professionals in a lot of ways. When it came to the task force that we just came off of, Election Systems and Software, which is a company that produces more than 90% of the voter tabulation technology used in the United States, actually denied the possibility that there could have been third-party access to their machines. Then, after an investigation, they provided a letter to a senator, Senator Wyden, also known as the Wyden Letter, several years later, in which they admitted that PC Anywhere, which was a software system that had a critical security flaw, was installed on several machines. So this brought up a lot of different issues that InfoSec advocates have been knowledgeable about for years, but really were never made priorities by the right people. One of which was the importance of user education and two-factor authentication. Well, multi-factor authentication is the subject of our next track one talk here. I'm sure that is going to get a more closer investigation. But just thinking about the weakness of third-party vendors, especially the weakness of third-party products when they're connected together without good governance. The smallest weakness thriving without that governance. The fact that 90% of voter tabulation technology was possibly upended by this weakness. And also the mystery, which is the real problem here, that from a hacker perspective, it's probably easy to overlook a lot of these faults, but the issue that ES&S originally lied about it and that an investigation was almost impossible because that admission came years after the original suspicions, a lot of states had to create their own security commissions to investigate this at their taxpayer expense. So if there had been more of a unified governance in investigating this technology, a lot of this response later would not have been necessary. But we're trying to move on here a little bit more into medical technology, which is something that I try to use as an example for good information security governance, because as I mentioned before, I've often found myself the only InfoSec advocate on a team or sometimes in an organization. So a few of the case studies that really resonate with the decision makers of healthcare are the ones that are also probably famous in the information security world. Anthem is the granddaddy of hacks. It began as a phishing scam and culminated in a 7-week window of access for multiple hackers in 2014, 2015 to access the names, healthcare ID numbers, and a whole lot of personal information for nearly 80 million customers and resulted in hundreds of millions of dollars in punitive fines. A state actor was postulated in an investigation in 2018, which was confirmed in 2020. But this hack was so massive that it made the numbers do this. The spike you're looking at is the year of 2015, when at the top left, you're seeing individuals affected by healthcare data breaches. At the right, you're seeing the size of average data breaches. And at the bottom, you're seeing the number of records exposed in hacking or IT incidents. 2015, that spike is almost entirely Anthem. But of course, you might be thinking, these numbers aren't helping me sell the importance of increased InfoSec advocacy and care. Well, these numbers do, because what happened was the hacks didn't disappear. They just decentralized. Median data breach size is at an all-time high, or at least it was with the last complete year of record keeping, as well as the number of healthcare data breaches that affected more than 500 records, and also the overall number of hacking or IT incidents reported by healthcare networks and their third-party vendors. And if this isn't enough to motivate decision makers, the fines aren't going anywhere. Although they have dropped in some cases, the penalties that companies pay for violating HIPAA, the Health Insurance Portability and Accountability Act, which keeps healthcare providers accountable for what they do with these records and who they might expose them to, end up paying just like Anthem, usually on a smaller scale. A couple other case studies that are related to this that came up a lot in decision-making about paying more attention to InfoSec are AMCA, the American Medical Collection Agency, which as a third-party payment portal allowed an unauthorized user to gain access to Quest diagnostic records and several other companies that used it as a third party. Same deal. Hackers access names and personal information for up to 70 million customers, at least 26 million confirmed so far. And it had repercussions for everyone involved. The product was immediately disabled, which involved a loss of trust in business for a lot of those big vendors, including Quest. AMCA operations were immediately suspended, and recently the whole company filed for bankruptcy. One of the big lessons from this particular hack was that the importance of vetting third-party vendors, that this payment portal had a lot of security issues that fell through a pretty poor governance system in the company that developed it and the company that ordered it. Next is SAIC, the Science Application International Corporation. This is famous for being a sheer bonehead move of data loss. An unencrypted backup including almost 5 million records for patients at TRICARE, which is the U.S. Army, Navy, and Marine Corps health insurance system, was stolen from a car while in transit. So this brings up a whole lot of issues. I've cited this so many times I've been accused of calling it the World War II of hacks, just because encryption is something that even in internal records is often overlooked, especially in internal records because there's some sort of buyout from dealing with it. But this and cases like it show that between internal problems that simply can't be predicted, and also the sheer bonehead move of not encrypting vital data from beginning to end, is something that executives have to look closer into. And the roles of the InfoSec professional when it comes to these big emergencies, just to wrap up the when chaos reigns section here, is to understand the risk profiles that a project or organization is undergoing. This, especially in medical care, is a highly diverse and changing set of scenarios, especially with IoT devices bringing up a whole lot of security concerns when they are brought into patients' rooms or interact with patients' other technologies. The legal and regulatory environment, HIPAA, for example, is something that we all operate in when we're dealing with medical records as any sort of professional. And that's something that InfoSec and IT professionals need to be highly aware of, is the regulatory environment that they're working in, especially when it comes to medicine or politics. And also considering the human and technological resources involved. This is less of an issue for people who work in big organizations, as people who work in big organizations can tell you. It's more important to have the work done than necessarily keep it under budget, but smaller projects and organizations might try to nickel and dime out from security concerns that could cost them big later on. So it's important for InfoSec advocates to consider what they have to fight from beginning to end. And also, some of the easiest moves are the ones that are most effective. Making lists of required data and unnecessary data, especially when you're holding your project or organization's ability to keep data safe in any kind of suspicion. It's important to eliminate unnecessary data from the chain wherever you can. That way, people simply aren't responsible for it. Systems simply aren't responsible for it. And then recommending work that could be done to execute your plans, creating guidelines for the organization or the team, or advocates for the user to consider. This is often more corrective than preventative. We often say in healthcare, we love our patients, but we don't trust them. So we often create protocols that simply edit out any possibility for the user to make themselves or the system vulnerable. And creating an incident response plan, because the next thing you'll have to do probably is respond to something. So corrective action, which organizations are often calling resilient action, the ability to get over something bad that's happened, is you're going to have to activate that plan. You might be the one to execute it. You might be the one to communicate it. You might be part of the team that runs it, but it's important to get it started as soon as possible. And also, leadership will want to know what contributed to the attack. And it's important in a lot of ways to know what sort of executives you are dealing with at this point, because do you need to use plain language? Do you need to use technical language? What's the likelihood that you're going to get the decision that's going to help you as an InfoSec professional make the calls that protect the data or respond to the loss of data? And also be immediately ready to advise future preventative measures, because the only real time that big organizations get anything done worth doing is when they absolutely have to. So this big emergency may also prove to be an opportunity in the classic sense of the word. And now, a little bit that might seem pretty obvious to people who've worked in any sort of corporate or creative environment, but where there is no help. We're going to go through a lot of the roles that you may communicate with when the person that you generally communicate with, who's often a project manager of some kind, is missing, distracted, incompetent, lost in a war zone, unavailable, been fired, etc. So instead of CPR, we've got ICR, that's identify, communicate, resolve. Partially because you have to identify who you need information from or who you need to give information to when the person who's generally going to do that sort of thing isn't there. You need to communicate it, get it back and forth, and then you need to make sure that whatever you just did resolved the problem, because that's often also the job of who's missing in that situation. So when it comes to medical technology development, here's a brief outline of the creative or technical staff that are often involved. And at the top, we're going to go through a lot of these roles: information architects, user experience researchers and designers, user interface designers, and then content, all often reporting to some sort of project manager who may pass on products or information to an account manager, and then eventually the executives who's ultimately responsible for the organization's work. Information security is kind of nebulous here because you don't really think of that as part of an agency setting, especially when you're producing communication and not necessarily technology. But it's always important when you're working with any sort of system that'll later handle records or collect data, transmit it in any way. And at this point in most healthcare settings, that's pretty much all technology. So going through these roles just to figure out what they might need from information security or technology in general, the UX staff, these are the people who create a lot of these products from the ground up. They analyze the need. They often reverse engineer results off of competitive analysis, looking at other developments that were similar or equivalent at some earlier point, and then try to provide some sort of framework on the client or the user's needs. This is usually a briefing for the UX designer. If they need to talk to information technology or information security, they often want to know what they can do. And this is also what you want them to know. They often make the decisions that help prevent unnecessary data or unnecessary interactions from occurring in the first place. And this is also in line with user interface, which is our next move here. Briefly talking about designers, they're the ones who translate a lot of the research into concrete plans. And they're the ones who either create or have to communicate the specifications. So this often relates to the ability to interoperate third-party information security apps or technology. They're the ones who are going to need to know how that might affect their project or other parts of it that they're juggling. Moving on to user interface, HCI issues is the number one thing that any IT people need to know about UI, is that they're the ones who are going to try to resolve all the user trust issues. They're the ones who are going to try to resolve the need for IoT devices or how they operate with data gathering mechanisms or systems. So this is also a big part where information security can give and get a lot of advice on how to work best in the organization. Because although a lot of what they create is then later moderated by UX and PM or also other design elements, they're often also the ones who can best communicate how to prevent unnecessary data from entering the system or prevent any sort of loss mechanism which doesn't have to exist in the first place. Information architects or the librarians, I was often an information architect, and making data logical is often, like, as it refers to InfoSec, more of an issue of preventing those unnecessary interactions or preventing any sort of unnecessary search by giving people what they want as fast as they need it. And content producers, this is less of an interaction with especially InfoSec, but IT in general. They're often, if they need anything or if they need to give anything, it's regarding specifications of a project or a product. And then we get to PMs, and we're wrapping up here. So talking about keeping all the team members working towards their goals. So they're often the coordinators of all of this work. When it comes to dev, tech, InfoSec, they're often reacting to a project within an organization through the PM. The PM is also responsible for the deadlines and the specifications. So when it comes to PMs talking about dev, InfoSec, all of that in general, they often just want to be able to give the specs and get back what they need to contribute to the product or secure the product. So, what to consider when you're working with PMs is sticking to the brief. A project brief for especially medical devices is the Bible. It's a starting point, but it's always the thing that defines what you're able to accomplish. So, if the brief has any sort of language about securing medical data or considering medical data security, that is often the basis for your work on a project. Then, even if you are not officially part of a project plan, it often helps to know the context. What's the project? What's the product supposed to do? What's the technology that it interacts with? What's on the back end? Do all of the parts of an app, especially if it's related to, excuse me, especially if it is related to a medical device or data collection unit, how do they work together? And what are all the specifications that are related? And then finally, as we finally run out of time, how executives often see a project or a product. Well, they're usually responsible for mitigating risk ultimately, and that is what we've been talking about a lot this morning so far, is assessing and mitigating risk. So, the results of their work has to be the reputation of the company, which is often what drives future business. So, they need to consider information security as an investment, as well as a marathon, not a sprint. So it's often an infosec advocate's job to express how things can be saved or projected into the future in a way that helps them do their job now. So what can be expressed in numbers when it comes to options for third-party vendors that are verified? What are the options when it comes to doing that work internally to keep a sort of chain of evidence over any sort of systems that deal with personal data? How do you reduce these risks, and how much protection will it buy to invest in them? And also, from a going back to the macro perspective, how do you get buy-in for a good information security culture? Who are the most likely advocates to join you in positions of power, who can really make a difference for an organization and multiple projects? And then, how do you prioritize these potential and real threats, which is also something that Spam brought up in the keynote, is threat assessment has to be one of the number one things, one of the real products that infosec advocates bring to the system. Consultation is often less of a product in itself, but those sort of protocols, that sort of ability to assess a threat and then allow others, including yourself, to prepare for it is the number one thing that you can bring to, and also the number one thing that you could recommend you bring in the future to these environments that are producing new products and projects. And with that, I guess I timed it almost perfectly, although I will now go back on Discord to answer any questions or help with any references. If you're interested in more of these case studies or any specific examples of communication, you are also welcome to email me. Also happy to provide the references that are directly refer to what we've been talking about today. All right, so thank you very much, and please enjoy the rest of BSides.